We are here for a very, very important part of this module, answering the question of why create a care plan. I'm going to take you through the steps to create a care plan. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. I am so happy to be here with you, privileged to be here with you, and I thank you for sharing this time with me. As always, you know what comes first. We focus on the housekeeping. I use the term elderly parent or elderly parents. Substitute that term with the person for whom you are providing care. Print out the outline for this module, print out the slide handout so that you can follow along with me and fill in the blanks on those very important ellipses, the dots. Let's talk about the objectives of creating a care plan. At the end of creating a care plan, you should be able to create a document to help you manage all aspects of care for an elderly parent and use this updated document to facilitate, coordinate, and adjust plans to care for elderly parents as needed. Creating a health history, identifying current health issues, listing current providers, and looking at alternatives for the care of an elderly parent will ensure that you have the tools to be proactive in managing and coordinating care for an elderly parent or loved one. Creating a care plan means that you will have detailed discussions and meetings with elderly parents about what mom or dad want for care. These are discussions that rarely happen until a care need forces the decision. By taking time to create a care plan and discuss wishes now, it's likely you may minimize stress, minimize family disagreements, and feel more confident to respond to unexpected situations. So why do this? Why make the effort? This is one of those efforts, a care plan, that may end up sitting on your desk or your list for a while because you don't see the immediate benefit. It's kind of like cleaning out that room at your parents' house that you know you should get done, but you keep putting off. Care plan is no different. A care plan is a term that I use for creating a health history, talking about current health issues, listing current treatments, making a record of past surgeries, information about medications, allergies, other health information. It's kind of like the encyclopedia of you or the encyclopedia of your elderly parent. And you gather this information from your elderly parent, you put it in a readily accessible document, which is this care plan that I'm going to give you. It allows you and your parents to provide accurate information to doctors and other healthcare providers and to manage ongoing care. This is a document that you update. The care plan is updated as time moves forward so that at the time of need, you have a thorough history. Every doctor appointment, you update it. Every change in medication, you update it. The question is, how well can you or your elderly parents recite your health background? Do you have a list of vaccinations with dates? Do you have records from past doctor appointments? How well can you describe the list of medical conditions and medications prescribed and explain why you take these medications? For most people, the answers to these questions are, I don't know, I don't have the information, I forgot, I can't remember. This is why creating this care plan can seem like a daunting task, but after it's created, honestly, you'll breathe a sigh of relief. This document will ensure that information to support your care is available for emergencies and unexpected situations. As you create this for your elderly parents, consider creating it for yourself, for your spouse, for your children. The reason to go through all of what seems like a lot of trouble and a lot of effort is that one day in a hospital emergency room, while you're waiting for surgery or you're at a doctor's appointment, somebody is going to ask you all these questions and you're not going to be able to answer them. If you have this care plan completed, you'll have your past and current medical history. Answering any question that a doctor or a healthcare provider asks you will be easy. You can simply hand them the document. You won't have to rely on your memory. You won't hope that you are remembering information correctly. You won't be searching through files that you don't have or files that you can't locate. You'll have it. You'll have a care plan. Here's another concept that a lot of people don't think about, but your medical history doesn't always follow you. And this is an example of why creating a care plan and collecting your medical records yourself is essential. When I was young, and I say young, in my early 20s actually, I had my tonsils out when I was about 24, and I had orthoscopic surgery on my right knee because I was a runner about a year later. The tonsil surgery went okay, but after that I came down with walking pneumonia after the surgery. And that probably happened because bacteria from my very infected tonsils went down my lungs. What do we know about bacteria from our mouth? We know that poor dental care, we know that gum infections, we know that infected teeth carry bacteria. Elderly parents swallow that bacteria, it goes into their lungs, it causes pneumonia just like it did when I was 24 because my tonsils were terribly, terribly infected. So having information about that, about my surgery, about what anesthesia I was given, my blood type, all of that would be helpful for me today. So about a year later, knee surgery. That went pretty well, except that anesthesia that they gave me made me extremely nauseated for hours after the surgery. I couldn't go home because I had to lay in a recovery bed for hours while my best friend and her mother were waiting to take me home, because on that same day, my mother was having bypass surgery, so my family couldn't take me. I had pre-work done for both of these surgeries, blood typing for potential transfusions. If I would have known the type of anesthesia that I had for my tonsils, I could have asked for that anesthesia when I had the knee surgery. I do know today, though, I tell all doctors at routine procedures, even dental work, colonoscopies, you name it, that the wrong kind of anesthesia makes me nauseated and I will be vomiting. I do not want to do that. I'm also allergic to a lot of other medications that most people take without thinking. Sulfa drugs for sinus infections, I can't take those. Pain medications, I can't take those. They make me nauseated. At the time that I was young, in my early 20s, I didn't know the importance of asking for these records. They are gone today. Couldn't even locate them if I wanted to. Here's what can and does happen to your medical history if you don't request copies and keep them. Most medical offices don't keep paper records for longer than 7 years. Now, most offices today are going to electronic records, but that is also a problem. If your doctor's office has electronic records and they change systems, they may not be able to find the files from the prior system. That has happened to me, but fortunately, I kept copies. If your doctor retires, if that office closes, if they sell a practice, those records are gone unless you request them. If you move from state to state, the records can be lost. All of this history doesn't seem important until somebody asks a question and you need those records. As that caregiver for your elderly parents, you want to become more knowledgeable about their health, your health, than anybody else. I had numerous situations where I had a client who was going in for surgery. And this particular client, they were wondering if she had any stents. So stents in her heart, any type of stents in arteries in her legs, if she had past heart surgery, what that entailed, if she had any mechanical metal in her body. Now, trying to guess whether somebody has a stent can be pretty hard unless you can get those records. Fortunately, I had the records so that I could answer the questions. And this is why obtaining the records, scanning the records, finding a safe way to keep them is important, because you may not need the information today. In 3 years, when there's a surgery, you may need it. You may need it in 10 years. It's important to obtain these records today for yourself, for your elderly parents, for all family members. Put that information into the care plan. Make it easy on yourself to provide care for yourself and elderly parents. As we talked, having copies of your medical records puts you in control. I always recommend requesting and keeping copies of your medical records, the records for your elderly parents. You can ask for a written document before you leave a doctor's office after each appointment if your doctor has electronic medical records. If the records are on a portal, sign up for the portal, print a copy of the records, keep them in a file or store them on your computer or on a flash drive. It's up to you as the caregiver or the medical power of attorney to collect and retain this information because it puts you more in control of your care and the care of your elderly parents. If there are other records that you don't have, request and store those records so that you have a full medical history that you can take with you to any doctor's appointment. Let's say that you change doctors or make a medical appointment. You can take the records with you to that first appointment rather than hoping that the office is going to request records or get all the records from a doctor who might not even have a full copy of your record. Having copies of your medical records puts you in control, which is exactly where you want to be. Let's talk about the details in a care plan. If you opened up the care plan document that is in this module, you can follow along. If not, take a look at this after you watch this webinar. Maybe come back and watch the webinar again. Definitely set aside time to start filling out that care plan. So information to include in a care plan for elderly parent would be all past surgeries, if you can get the records or if you have the records, with the dates, the location, any type of associated medical treatment, a list of medications that they're taking today that correspond with medical conditions, names of doctors, specialists, their insurance information, their burial and cremation plan if these exist, allergies, any other vital information to manage their health and well-being should be in this care plan. Details to discuss with your elderly parents include the idea of asking, what would you want when? For example, what do I want when I need help in the home? Is it my children? Is it a care agency? What are my wishes for care if I receive a diagnosis of Alzheimer's disease? What do I want at the time when I might need to move to a care community? If I was diagnosed with Alzheimer's and I could no longer use a fork to feed myself, would I want someone to feed me? Be as thorough and explicit as possible in this care plan. Put all of your elderly parents' wishes in writing down to the smallest detail, like, my feet are always cold. Please make sure that I'm wearing socks if I can't tell you. Talk about food wishes. For example, likes and dislikes, like never feed me lima beans, liver, or onions. Why is this important? It's important because there may be a point where your elderly parent is in a hospital or in a care situation where they can't speak and you're not there to speak for them. When I was a court-appointed guardian and medical power of attorney, financial power of attorney, and a care manager, a lot of my clients didn't know their health history. I gathered this information. I created the care plan that I am sharing with you. My staff use this care plan. Healthcare providers use this care plan. If you really want better than average care and you want to avoid unnecessary mistakes, create the care plan. The doctors and the medical system do rely on the information that you provide and that they can collect, and sometimes their information is faulty. So let's talk about using my care plan. I developed this care plan and updated it over 20 years of my experience in working with the elderly and disabled adults. Take a look at the document if you printed it out. There are multiple sections, as you will see. And when you initially fill it out, you may have a lot of blanks because all of the information may not apply. But in my practice, we updated the care plan with weekly client contact notes and calls to doctor's appointments. So underneath the care plan, I would put, today's date, let's say it's March 31st, and I put the year. Spoke to Dr. X, asked question about why. He recommended ABC. The benefit of this is because If you ever have to remember a discussion that you had with a doctor, you may not be able to do it. But if you have it documented at the bottom of this care plan, you can go back and look, because sometimes providers will give you inaccurate information. The goal of this care plan is to use it as a living plan, a living document to manage, establish, and oversee care for your elderly parents. The care plan really allows anybody of any age to begin and start documenting a medical history that will be helpful throughout a lifetime. You can use the form for your children to track vaccinations and any other medical information. Use the form for yourself. Use it for elderly parents. Consider it to be the encyclopedia or the Bible of your health. Let's talk about caregiving responsibilities, because this idea of care planning, it's all inclusive. It includes care planning, includes managing the care of your loved one, communicating with healthcare providers, and advocating with care services. When an elderly parent has health issues, you are coordinating with multiple providers. There are a lot of opportunities for things to go wrong, for gaps to occur in care that can harm an elderly parent. You don't want this to happen. Document every conversation, the date, the time, the name of the person you spoke to, even the phone number that you called, the email address that you used, whatever the agreed upon follow-ups were. Type this all out, because when a person in an office that you talk to finishes the conversation and you call to follow up, you'll have a note trail of that conversation and any requests that you made, so that nobody can say, well, you never called. You'll have proof. I also recommend saving all emails, turn them into a PDF document. Offices will tell you that you never sent an email. They'll tell you that you never sent a fax. Also save those fax confirmations. They'll say that you never spoke to them. It's a shame that caregivers and patients have to prove your actions, prove that you called, prove that you faxed. Happens all the time. It happened in my practice. This was a daily battle for us to work with people, make progress, get the information that we needed, and not have them say, well, you never called us. So here's some of the information that is included in the healthcare plan. So it's your contact with healthcare companies, caregiving agencies, insurance companies. You document those phone calls, document the history, health insurance, hospitalizations, medical procedures, medical appointments, medications, pharmacy names. Document household providers and schedules, even down to who cuts the lawn, who mows the snow, who's the CPA that does the taxes, where's my bank. All of this information goes in that care plan. You also want to document personal preferences and history. The details of your elderly parent's personal history are important. The care plan is the beginning of helping you become an advocate for an elderly parent. All of this personal history, these preferences are essential when your parent is hospitalized, in a nursing home, or in a care community. The details you provide from this document help the staff know and understand likes and dislikes, preferences for care that they would have no way of knowing about. Having this document, as I mentioned, is especially important if you're not around, if your elderly parent doesn't feel well, or if there's nobody to answer questions. So don't skip any details. Include as much as possible. Make the document as long as you need to. Include personal preferences, personal history, even people that your parents don't want to share information with. If there are issues with family relationships, include a history and the names of family members so that any particular person cannot cause problems with the care of your elderly parent. And do include end-of-life wishes and plans, which are very important in the event of unexpected situations. So the summary of creating a care plan, as you can see and as you will see as you go through this document, it's very detailed. It's valuable when you are a spouse responsible for another spouse or an adult child helping out mom or dad or another family member. Completing this care plan, completing this document, will help healthcare providers to provide accurate and thorough care for a loved one and avoid mistakes. Care planning relieves stress in day-to-day activities. It avoids trying to piece together information in an emergency when you might be emotionally upset and not thinking clearly. So your follow-up is to complete this document. Your follow-up is to complete a care plan for your elderly parents. Do it for yourself at the same time. This care plan is a routine that conserves your brain energy. You won't have to remember all this medical history for your elderly parent. It will be in a simple document that you can look at. And the routine of updating it over time is valuable. Again, it might be hard for you to see the value right now because there isn't an immediate need, but I can tell you when an emergency happens or your parent has a heart attack or breaks a hip, if you have this document, you will be so relieved and less stressed that you gathered all of this information, and it will benefit the care of your elderly parent. I'm Pamela D Wilson. Thank you for joining me for this webinar. As always, I will see you soon in another webinar.